Deputy Foley, and thank you again for your patience during the first session.
Okay, thank you, Cathaoirleach. I'd like to begin by welcoming the witnesses here and expressing unreservedly gratitude for the superb work of the HSE and the staff of the HSE over the last number of months, but indeed on an ongoing basis, and indeed to acknowledge unreservedly that many, many lives have been saved the length and breadth of this country as a consequence of that work. However, it would be remiss of me if I did not shed light on what my constituents would regard to be some shortcomings in that service, and indeed what my constituents would believe has resulted in the endangering of lives due to actions or inactions over the last number of weeks. I refer specifically to Direct Provision Centre, the Skellig Star in Carsaveen, County Kerry. And I wish to pose a number of questions in regard to this particular facility and direct provision centres, and following that I would ask you to answer, and then I have two further points to make. Could I say from the outset that, Mr Reid, that the Department of Justice claims unequivocally that the HSE failed to inform them of a positive case of COVID-19 at a travel lodge in Dublin on March 8th, a travel lodge that was home to a large group of asylum seekers. Is this actually correct, that the HSE failed to inform the Department of Justice? The Department of Justice also claims that the HSE nationally signed off on the movement of people from that same travel lodge to the Skellig Star in Carsaveen, a 5-hour bus journey, without testing the group prior to leaving Dublin, and indeed not testing them on arrival into Carsaveen either. Is this true? Is this factual? Are you aware, Mr Reid, that the regional office of HSE Cork Kerry expressed serious concern, serious misgivings about the movement of a large group of people during a pandemic, and equally so expressed grave reservations as regards the suitability of Carsaveen as a location for a direct provision centre due to a lack of primary care facilities in the area? Clearly, these concerns were overruled. And I put it to you, Mr Reid, who exactly overruled these concerns? Was it HSE nationally, or indeed was it the Department of Justice? Could I also put to you the fact that there has been evidence of what I would consider not best practice in this direct provision centre, given that there are now beyond 26 cases of confirmed COVID-19, and residents here continue to share rooms, although it is not best practice, when they are not blood relatives. There is absolutely no social distancing given the size of the premises, so there is a shared laundry room, there is small public spaces, sharing of lift, etc. Equally so, can I point out that there has been absolutely no professional deep cleansing of this facility at any stage during the duration of the 26 confirmed cases, and residents continue to live there. And can I ask you to explain also, as the body charged with public health, how from the first diagnosis of COVID-19 it took 39 days to have a public health presence on the campus of the Skellig Star? I'll allow you to answer those, and I have two further points to make with your indulgence, Chair.
Chair, I'll just make a few comments, and then I may call on one of my colleagues also. Just thank you, Deputy, for your opening comments, which we'll pass on to everybody. I'm sure they've heard them. Secondly, in relation to the Department of Justice and the Skellig Star and Carsaveen, we've been working very cooperatively with the Department of Justice over the last few weeks, specifically in relation to the location that you mentioned, and it's been the subject of joint engagements between our own public health teams, our local community teams, and indeed with the Department of Justice officials at a national level. And indeed, it's been the subject of discussion between myself and the Secretary General of the Department of Justice. So it is true. There's been a lot of engagement, a lot of collaboration working with us and trying to address the issues. Specifically in relation to our role in terms of that, we would give our public health advice and give it very clearly. Indeed, it's very well publicised what our public health advice is. There is an obligation on the owners and there is an obligation on the operators of various direct provision centres to implement the advice. And a lot of occasions we would go in, and in that specific case, we would have gone in, our public health teams would have gone in and given specific advice on the location, both in terms of advice for staff and for people in the direct provision centres themselves. So there would have been a lot of engagement over the last few weeks, as I understand, and as I've been engaged locally with the teams down there as well. So there has been significant engagement with ourselves. I can't comment on the particular case that you mentioned, just in terms of a positive case and the testing. I don't know the detail of it. We're happy to come back to you on it. But I do know in terms of our Cork Kerry community-based teams and the public health teams, they've put significant supports in place there, not just in terms of advice, but the implementation of public health advice is the responsibility of the centre themselves, and we will go in and support them in terms of what they need to do, but there is an obligation on the centre themselves to do it. Separately, clinical care for anybody, we've been providing that pathway through our own public health teams as well.
Could I just conclude?
Thank you, Mr. Reid. Just one very brief question.
Yeah, one very brief question. Could I ask that you would revert to me in writing with the questions that I have posed? They are hugely important to the residents and indeed to the community of Carcevine. And two things, as HICWA has no overall remit here, I would ask that you would at the very least call for an unannounced inspection of that premises, and on foot of that inspection, which I am confident from all that I know it will fail it, as a consequence of that, on a public health measure, as a matter of health and safety and the welfare of everybody concerned, you will call for the immediate closure should that public health inspection be failed. Thank you.
Mr. Reid, will you be happy to answer any questions by way of correspondence that haven't been answered?
We'll ask the local community teams through our officials here to make sure we get a response locally in terms of the issue here.
Thank you.